1590 WSMN presents Friends of Kevin Radio, hosted by Kevin Willett. Kevin is the founder of Friends of Kevin Networking, a unique networking group which brings together the business, nonprofit, and artistic communities. If you're an owner or manager looking to expand the traffic of your business or are looking to embark on a new career path, look no further than to Friends of Kevin Radio. Kevin will provide networking tips on social interactions and how you can properly utilize social media to highlight your portfolio. Everyone's a friend on Friends of Kevin Radio on 1590 WSMN, Nashua's News and Talk. Now here's your host, Kevin Willett.
Hello and welcome back to the Friends of Kevin Radio Show. I'm now joined by my friend Dr. Agape from Agape Dentist. Hi, Dr. Agape, how you doing?
Good, Kevin. How are you?
Things are always good for me. Hey, I want to start at the beginning. Let's talk a little bit about your practice, where you're located.
I'm located at 576 Main Street in Woburn, Mass.
So one of the questions you must get all the time, and I'm kind of interested in your opinion on this, is why are people so afraid to go to the dentist?
And there's a range of reasons. Either a bad experience in the past, or they're simply afraid of the needle, and mostly it's just afraid of the unknown.
True, because I find a lot of people end up in this kind of circular situation where, you don't go to the dentist for a little while and you're like, geez, now I'm so embarrassed to go because you're going to look at me and go, Kev, when was the last time you've been to the dentist, And
exactly.
So they just stop going.
Is one of them.
But it's like, well, that's just a horrible idea because eventually you have to go. So the longer you put it off, or I have friends, well, whenever I drink soda, my back tooth hurts. It's very sensitive. Well,
yeah, exactly. I tell patients that are afraid, I said, prevention is your best friend at this moment. Just go simply for an exam and a cleaning, and if, catch things early, get them done, get things done before they blow up.
Right.
And this way you don't have to deal with it after. So deal with it before it blows up. That's what I tell them.
Well, but it's true. I know I've been guilty of that in my life when I was younger. I didn't take great care of my teeth, and then as I got older, I realized I had to do that. And not to be vain about it, but your teeth are an important asset as a business owner too. And you do get judged in your appearance.
Exactly, and your teeth is the portal to everything that goes into your body. So if the gum is inflamed and the teeth are bad and there's bacteria, you're chewing food with harmful bacteria that is you're swallowing that into your stomach, and then the digestive system, transfers all that to your bloodstream, and then there's increased acidity in your bloodstream, which can cause other diseases. And as you know, there's very close connection between heart disease and gum disease. And in the past few years, I'm pleasantly happy to see that doctors finally, they tell their patients, make sure you check with your dentist before we start any treatment of cancer or anything like that. They didn't do that in the past. I'm seeing it more often, which is finally doctors are aware that your mouth is part of your body. It's not walking next to your body, so you have to take it, seriously.
Like I said, I recently just read about how there's a relationship between your teeth and your heart. As someone with heart issues, obviously I pay attention to things like that. I never would have done that math. I mean, when you think about it, it's logical. Like you said, it is part of your body and stuff. But people don't realize just the impact it can have on just poor hygiene.
Absolutely, and that's where it starts simply as a teamwork between the dentist and the patient. I tell my patients, I'll do the best dentistry I can, and you can do the best and fanciest dentistry, but if you don't take care of your gum and do the basic things of brushing, flossing, and rubber tipping, all that work will be down the drain, and it will be a loss if the gum is inflamed, and there's with inflammation acidity, and that eats away the calcium around the margins of my fillings and my crowns and ruins all the work.
Right.
So, yeah, exactly. So brushing, flossing, and rubber tipping is crucial.
Yeah, so like I said, I just want to go over that. What are some of the tips that people can do to make sure they keep their teeth healthy?
As simple as that. I tell them, if your gum bleeds, that's not normal, because we don't walk with bleeding skin. If your skin is bleeding, that's not normal. You'd be rushing to the doctor, hey, my skin is bleeding. What's wrong? You'd be scared, actually. And I have patients, they tell me,
that really is an excellent point.
Yeah. They tell me, you know, if I started flossing and now I'm bleeding, so I stopped flossing. I'm like, no. When you see a drop of blood from your gum, that's when you need to double your effort. If you're brushing and flossing once a day, then you need to do it twice a day until this gum stops to bleed. You don't stop. On the contrary, you double your effort. And I always explain to the patients the technique of brushing. It's not how hard we brush, it's how long we brush. So I like my patients to brush with the electric toothbrush, gently, not pressing hard, half the bristles on the gum, half on the teeth, because you want to massage the gum while you're brushing your teeth. I like 2 minutes on the top, 30 seconds on each quadrant, and 2 minutes on the bottom. I want them to floss. And patients with perio disease, meaning they have 4 or 5 millimeter pockets, I tell them to rubber tip the cheek side and the tongue side of the back teeth only. And perio patients, I tell them to come every 3 months, and that's forever. Because perio disease is like diabetes. Once you get diabetes, you cannot get rid of it, but you maintain it by taking taking your medicine,
right.
Watching your sugar intake, and all of that. So you live with the diabetes for the rest of your life. And perio disease, unlike gingivitis, is like diabetes. It stays with you for the rest of your life. So I tell those patients, you have to go to the dentist for the rest of your life every 3 months for a cleaning and a checkup, because those pockets can come back very easily, and they need to brush, floss, and rubber tip. I recommend brushing and flossing for gingivitis, brushing, flossing, and rubber tipping for periodontitis.
Because now, one of the comments, and I was listening to you speak, is the average person doesn't brush their teeth nearly long enough then.
No, they brush too hard, and the bristles of the brush are bending. I'm like, you're not doing muscle toning on your gum, are you?
That's awesome.
So I say to them, you don't want to brush, you don't want to do my work and drill the enamel of your your teeth, and then hack your gum. You don't want to do that. It's not how hard we brush. I always recommend soft bristles, not medium, not hard. It's the right technique, the right angulation, and the length of time that's crucial.
And now, how often do you recommend someone flosses? Have people floss, after every time they eat, once a week. How often should someone floss?
Every day. I call flossing like cleaning under the armpits. You got to clean it every day. Because the skin defense between the teeth is weaker. The skin defense on the outside and the inside, like the cheeks and the lip side and the tongue side, is very thick. The skin layers are thicker than the skin layer in between the teeth. So gum disease really starts mostly in between the teeth. That's where it first starts, and that's because of the weak defense of the skin cells. And this is where you need to remove the plaque in between your teeth, and it's at least once a day. And sometimes I recommend twice a day until the gum stops bleeding, and then I put them back to only once a day, but definitely once a day at least.
Because, like I said, I see a lot of people, get confused over that. Now, how about what age should a child start going to the dentist?
Between 2 and 3, depending on how cooperative the kid. If they're very cooperative and mature for their age, by 2.5, 3, I find kids are very cooperative at 3. But 2 to 3 is the normal age.
Well, like I said, I wasn't really sure about that, because that seems to be an issue. A lot of people, sometimes wait too long, and then, like you said, they've already have issues and stuff. So it's kind of good. Now, how about teeth whitening? A fan?
Teeth whitening, first of all, I tell smokers you're wasting your money if you do teeth whitening, because the nicotine will stain the teeth while we're doing the teeth whitening. So I highly recommend not smoking. So I recommend once a year for teeth whitening, and I find out that a lot of patients, they buy over-the-counter material
right.
For teeth whitening, and they whiten their teeth every other day or twice a week, and they dissolve their enamel, and I'm like, I don't do that. I've had one patient that pitted her 2 front teeth, and that's because she was bleaching. She smokes a little,
yep.
And she felt like she wants to bleach every day, so she does it every other day, and she ended up with bonding on her upper front teeth because she dissolved her enamel. So once a year is plenty, and once every 2 years is even better, because it depends of their eating and drinking habit. Are they red wine drinker every night? Do they drink a lot of cranberry juice? So it's the habits of how we eat and drink really affect the discoloration of our teeth. So once a year, but not more than once a year, because you don't want to abuse the enamel.
Now, this may be kind of a silly question, but can you put a tooth back in that's fallen out? Like you always see, like someone gets a tooth knocked out, falls and trips or something, and they're trying to get it and put it in milk or something and bring it back. Can I really put it back in?
Absolutely, within the hour, and the sooner the better. This way we preserve the vitality of the tooth so the tooth doesn't end up with a root canal. The most important thing is when the tooth falls out, don't panic. Just carry the tooth from the coronal portion, not the root portion, because we want to preserve the tissue around the root. And if there's any dust, just rinse it gently, not with like a hard gushing water, just a gentle running water. And then the best way, if you don't have milk, is put it under your tongue and just rush to the dentist.
Put it under your tongue?
Under your tongue, yes.
Wow.
It's even better than milk, yeah. If you don't have milk and you're outside, out and about, put it under your tongue and rush to your dentist, and the dentist can put it back in, and obviously they watch and observe it and watch the vitality, and if it needs a root canal, then we do a root canal. If it doesn't, so we watch it, we take x-rays and all of that, but within the hour, yes.
I was always curious if that was real or not, because you hear it, like, is that even feasible? So that's why I wanted to ask you today, so we could get that on the radio. So cool. Do you have any advice on how to pick a dentist? Like I mentioned to you jokingly, I've had some really great dentists, and I had some dentists that, really weren't great. How do you pick somebody?
Well,
honestly, to me, it's personality. Like, you've come out to a number of Friends of Kevin events, and you're very approachable. You're very down to earth. I could see why people would want to go to you.
Thank you, Kevin.
Please consider the compliments intended. But like you said, if you're just sitting there looking at, online, dentist in town X, how do you know?
Well, now with the social media and the online thing, so you get like reviews, so they kind of get a feel of the dentist and before they come to see the dentist. But for me, as a person, I'll talk about myself. People are different personalities. Some people is more of like they want a relationship more than anything, because let's be honest, nobody knows the technicality of dentistry when we're working in their mouth, but they perceive that okay, this dentist is good because she's like detail oriented. She's taking her time. She's taking it slow in this procedure. They need to feel comfortable. They need to feel that this dentist is honest with them, and they need to feel that they're getting the quality of work. Yeah. And that's a sense of the patient that can get. And I recommend to people, go meet the dentist. Go for the first visit, and if you feel comfortable with the dentist, then proceed and take it from there. And nothing wrong with that. And
that's awesome advice.
Yeah, I spend an hour with the first new patient visit, because it takes me I have a questionnaire, 2-page questionnaires. I ask patients because I want to know them before I work on them, because you can't work the same way on every patient. People are different, so you need to customize the way you work and approach them when you start working in their mouth differently. People are different.
True, but it's really great advice, because like you said, you're one of the key people in my life, I'm counting on you to keep my teeth, at the best they can be. Obviously I got to do my work too, but it's important I have that level of comfort with you, otherwise it just really won't work out and stuff. So we got one last question, then we have to run. Do you ever recommend people get their teeth cleaned more than twice a year?
Absolutely. Patients that have 4 or 5 millimeter pockets on each quadrant, like 1 to 3 teeth that have 4 or 5 millimeter pockets, I recommend those are called early perio patients. I recommend 3 months cleaning, and not for the rest of their life. And also 6 and 7 millimeter pockets, those patients need gum surgery. Also, after they are maintained, the gum surgery is done, they maintain it every 3 months. Yeah, perio patients every 3 months for the rest of their lives, and it's like diabetes. Perio disease is like diabetes. You cannot get rid of it, but you can maintain it, and that's the way to maintain it: brush, floss, and rubber tip.
So we're already at the end of the segment. That was pretty quick, just like we promised. How do people get in touch with you?
Well, they can Google Agape Dentist. It's A-G as in George, A-P as in Paul, E, Dentist. And Agape means love. It's a sacrificial love. And it's also Agape, mouth wide open. So it's play on words. And they can reach us at the office phone at 781-935-2200.
Great. We appreciate you taking the time out of your day to come on the show. And as always, thanks for being my friend.
Thanks, Kevin, for having me. Take care. Have a wonderful new year.
Same to you.
Quick commercial break. Speaking of which, Happy New Year's to you and yours. It is 26 degrees outside here on a cold day in the city of Nashua. Quickly want to let you know Kevin's next networking event will be Tuesday, January 8th at Eastern Bank in Chelmsford, Mass. from 6 to 8. For more information, log on to friendsofkevin.com. Quick break, back with more here on 1590 WSMN.